a perfect lead-in. We didn't even coordinate that, but my first picture here was actually this one, right, to show you. This is Dr. Collins' wedding, and how long ago was that, Dr. Collins?
6 years.
6 years ago. So this is us. This is Dr. Collins after his wife let him get back on the mountain bike for the very first time. So this just happened a couple of weeks ago. This is his new mountain bike that his wife let him get for their anniversary. And this is Awesome Kids Day. And I guess the reason I show you this is because I've seen what a driving force this community has been for Dr. Collins to help make Burien the most vibrant, vitalistic, healthy place on earth, right? How many people went to Awesome Kids Day like last month, right? That was such an amazingly wonderful community event that was everything to do with health and kids and growing and developing and nurturing that play spirit. That I was amazed by that. And I thought it was one of the most wonderful days. And I think it was a great culmination of the years that Dr. Collins has been here to be able to do that. And so I'm grateful to be able to be here today, tonight, to talk to you guys about this. This is a topic that I'm really passionate about. I want to be able to take this talk wherever the room wants to. I think we got a nice sized group here tonight, so if you guys want some more color or some more detail on anything that we talk about, I'm happy to take questions as we go. So just kind of point it out, and we can kind of go down whatever road we feel like we want to. So please take advantage of that. So Dr. Collins did a great job of leading into it, right? How did we get so sick, and where did that come from? And so I want to talk about a little bit about the why and about the how, right? How does this imbalance start to happen? And I think the big word that we can use is homeostasis. Homeostasis is balance, right? I think all of those things that we start to do from the outside in start to destroy our balance and destroy our connection with our bodies. And it starts to interfere with how we react to the environment around us. And it leaves us very susceptible to those germs that Dr. Collins talked about. Another thing is this linear thinking. Everybody see okay? Linear thinking is, I've got a symptom and there's a pill for that. I've got depression, I need antidepressant medication. I've got a hurt knee, I need some Advil for that. And it's this in a vacuum, very straight line, very linear sort of thinking. And we think that those decisions have no consequence to them, right? And I guess the thought that I want to be able to propagate through this talk tonight is that all of those decisions and all of those choices, right, in those moments of time can be taken very 1 + 1 = 2. As we go through our lifetime and as our children develop, 1 + 1 starts to equal 11. Especially with our immune system, because our immune system works in a way that balance is where the strength of that comes from. And so where has this led us to today, right? The numbers are out there are staggering. I don't want to get lost in the abstraction of numbers too much tonight. But when we start talking about 1 in 4 kids today either have autism, ADHD, allergies, or asthma. And all of those things are a chronic disease. Some of them neurologic in base, and some of them an immune system based. And so when we start talking about all of these kids are on drugs, right? 25% of children today take a prescription drug for a chronic illness. Those words should never go together. Chronic illness in children, right? We've actually started changing names of diseases because of how young these children are getting sick, right? Type 2 diabetes, right? Used to be called late onset diabetes, right? Now it's type 2 diabetes that all of our children are getting because 1 in 3 kids are obese, right? And let's not leave out autoimmunity, right? How did we get to the point where our bodies and our systems are actively fighting against ourselves, right? How does that happen in this great country, right? When we have access to such wonderful health care today. And so one quote that I like to always kind of point out with this is that immune-mediated disorders arise in direct proportion to the affluence of a community. And we're not talking like where Bill Gates lives. We're talking about right here. We're talking about Burien. We're talking about Queen Anne and Magnolia, where I live. We're talking about Des Moines. We're talking about SeaTac. We're talking about the areas and the communities that we live in. Because these things aren't happening in other communities. These things are happening in our community, right? They're happening in our back doors. Their children sitting in our schools every day that this is happening to. It's becoming more and more prevalent out there. And so when we start talking about the immune system, I want to set some basics on how the immune system works and how it functions and how it's put together. And so this is a very simple diagram just to show you that the immune system is 4 parts of our body all working synergistically together. So when I point out that linear thinking piece, like 1 + 1 = 2, well, in this case, 1 + 1 has to equal 11 because we talk about the autonomic nervous system, which I'm sure Dr. Collins has spent a lot of time talking about with you guys. It's one of my favorite topics as well. But the autonomic nervous system is 95% of our nerve system. It's the brain, it's the spinal cord, and it's all the connections to all the different organs and glands. The GI system, 70% of our immune system lives in our gut, right? I think that we are starting to pick that up a little bit. We start talking about the endocrine system. The endocrine system is simply the system that makes our hormones and our body chemistry and all the pieces that start to float around in our bodies. And then we have the immune system itself. So we're going to focus on the immune system itself tonight. We're going to start to maybe touch on those other areas just a little bit, but we're going to spend a lot more time on that immune system itself as we go. The strength, like I said, the strength of the immune system is focused on the control and the coordination of all those systems together. And we can't just focus on one. We can't say that my gut, I got to remake my gut to make my immune system stronger, right? We've got to focus on making sure we have a clear nerve system. We have to make sure that we have a clear, well-balanced endocrine system. We also have to make sure that we can do those good things for our immune system to make sure that it comes back to balance. Because if we don't focus on those things, it's just like the tire of a car. If one of those things starts to go bad, it affects everything else together. And so this is the immune system. This is the buckets, right? Over here on this side here, we have 1/2 the immune system. That's called the Th1 portion of the immune system. This is your fast-acting, quick strike attack force. This is those germs that Dr. Collins talks about, those germs that want to get in. This does everything to get those germs to get out, right? This is fever, this is diarrhea, this is vomiting. This is the externalization arm of the immune system. The other piece on the left side over there, that's the Th2 portion of the immune system. And so this is the memory system. This is the antibodies. This is the long-term fighters that start to swim around in our white blood cells that can recognize that germ that we saw last year and put together a quick, more efficient response to those germs that want to try to get in, all right? And just like this says in the middle here, is that the strength is in the balance of this. And so let's talk about how this becomes imbalanced. Because when the system becomes imbalanced, the term for that is called a Hemorral Shift. And what starts to happen is that the immune system works in paradoxical motion, meaning when one side gets stronger, the other side gets weaker. And what we start to have is a very weak, prone immune system that starts to go down this vicious cycle and this vicious drain that starts to get weaker with time because we have to start doing more things to it. And I think that this process is starting earlier and earlier today. I think it's starting with pregnancy, right? We're treating pregnancy today as a disease process, right? We're starting to do more interventions to these moms, these young expecting moms. We're doing more to their bodies in the name of controlling this situation. And so if we could, I wanted to kind of walk through just a normal, everyday process from pregnancy all the way to where we get a kid into school, right? And all the things that can possibly happen because this is the most vital time for these developing children's immune systems. So as we go, pregnancy now is a stressful, fear-based situation, right? I had a mom in a couple of weeks ago. She's a first-time mom. Her husband works. He's gone a lot. She's kind of there by herself. She came back from her 36-week check-in, and the baby wasn't head down yet. And so what they wanted to do is they wanted to do this deep, visceral, manual turning technique of the baby. So they wanted to put her on a table with a hole cut out on the table, put her face down, give her a local anesthetic, and go in there and manually turn the baby, right? Now I know that procedure has a 70% success rate for helping that child go face down or go head down, right? But at what cost? And what happens is that what they didn't know, because she just gave birth, what they didn't know is that the placenta, usually the placenta is one lobe, right? But the placenta, they couldn't see this on the ultrasounds that they had done, but the placenta had grown 2 lobes and the baby's head was right in the middle of that. And that placenta sits right up here. Luckily, she didn't elect to do that procedure, right? But what had to happen was they had to do an emergency C-section, rightfully so, right, in that situation. But can you imagine what could have happened to that baby as that starts to go? So we don't have all the information. When we starting to take over from nature, these sort of things cause more and more problems. And so C-sections, right? C-section, what's the C-section rate down here at Highland, Dr. Collins, like 40%?
It's well over 40%. It's 40% King County, right?
Yeah.
So Highland's carrying the lion's share of that at the moment, I'm sure. I bet it's over 50.
Okay. So every journal, medical article, whatever you want to read, whatever stat you want to tout, is that the National Institute of Health, the WHO, all these big health organizations that look at how things are done, state that the C-section rate should be 10%, right? 10% of the cases need an emergency C-section to make sure that mom and baby are safe and they can both enter this world properly. So over 50% at Highline, 40% in Seattle where I practice. So what we see with this, I don't know if you saw this, but I just got this information. Consumer Reports put out an article on C-sections in hospitals because this has been growing out of hand for so many years now, right? $5 billion could be saved if we cut the national C-section rate in half. Well, guess the days of the year that have the least amount of births on them.
Saturday and Sunday.
Yeah, it's that.
Holiday?
Christmas, 4th of July, 3-day weekends, right? It's because we plan those procedures ahead of time. Nobody wants to work on those days. And we start to think that we become more intelligent than nature itself, and we want to take over these procedures. There was also some quotes in there from some doctors stating that the doctor could talk any mother into having a C-section, right? That's where it's gotten to these days. And so it's becoming a very intervention-based, stressful situation. And one thing that chiropractors talk about is that mom's nerve system becomes baby's nerve system. And so if mom is stressed out during the whole process, that's all the information that baby in the womb is giving, right? Is stress, 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 stress. So before this baby even enters the world, we're starting to sway, right? We're swaying that neurologic system to know nothing but stress, and we're starting to sway that immune system to know nothing but stress as well. And it's starting to weaken it. And then we talk about the birth process itself, right? We talked about C-sections a little bit. One of the big studies that I always quote when we start talking about birth injury, just the delivery process itself. There was a big study done, it's called the Gutmann study. The Gutmann study comes out and says that 80% of births, right, healthy, what they consider healthy natural births, 80% of those children have an injury to their upper neck that causes neurologic and motor control dysfunction of their arm and their hand. So what happens is that we use the head as a lever, causes birth injury up here, which is very important, right, both neurologic but also immune system-wise. Enough that it causes a neurologic and motor control interference to that baby's hand. So 80% of those kids. Dr. Collins, how many newborns did you adjust today?
2, 1.
Yeah, I mean, I adjusted 1, right? So where are all those kids at, right? We know the stats. Who's checking those kids and who's adjusting them? Because one of the biggest connection that we have neurologically sits right here in the brainstem, and it controls the immune system, and it controls the connection between the brainstem, the heart and the lungs, and the stomach. And so right away, right, we've got this train rolling here a little bit, right? So breastfeeding. I think there's a great community out there that's really pushing the importance of breastfeeding these days, right? We're seeing all those great pictures out there of moms breastfeeding in public and taking that opportunity to show how important that is. I think it's wonderful, right? I wish it was as successful as the ALS challenge myself, because I think it's as important, right? Because there's so much good stuff that comes from breastfeeding. Specifically, when we start talking about the immune system and how the gut forms, there's this antibody called Sig-A that mother's breast milk is just very high in, right? And Sig-A, what it does is that this antibody helps develop normal, healthy, natural gut flora, which is the starting point for a child's immune system. It's very low inflammatory rate, and it helps start this process rolling. What happens is that we have moms that can't breastfeed out there these days. We do more formula feeding these days, and those things don't have that specific antibody that's supposed to be passed from mom to baby to help start that process. Now what's really starting to, now there's a trend out there because we've entered this generation where we're getting the second and third generation of children to the point where these people have all been through the vaccinations, right? They've been through all the vaccinations, right? Maybe they've had some birth trauma themselves, and they don't have, or they don't pass that antibody to their child. And if mother doesn't pass this antibody to the child, that child who grows up and then gives birth doesn't have it to pass to their child, right? And so this is kind of the trend that we're getting into, is because this population is growing higher and higher with time. And all of a sudden we have children right out of the gate who've had nothing but a stressful pregnancy, an intervention-based birth that caused injury to their upper neck, and we have moms and babies who can't significantly establish a normal, healthy gut flora that starts the immune system rolling, right? All right, everybody's favorite topic, right? Vaccinations. Slip my jacket off here.
I'll get serious.
I know, right? Yeah. So, vaccinations. I think that before we get started with vaccinations specifically, we have to talk about the vitamin K shot, right? The vitamin K shot is typically the first shot that a newborn baby gets at the hospital. The vitamin K shot is there to help bleeding, right? The vitamin K is there to stop and help the baby clot blood. So if they get cut, they're able to do that. Brain hemorrhaging as well. However, the stats on this are kind of out of balance a little bit. What we know is that 4 out of 4 million newborns are prone to this condition that causes some brain hemorrhaging that the vitamin K shot is there to help stop, right? So it's actually such a low percentage that we can't even put a stat on, right? It's not even a stat that's kept because that statistic is so low, right? But we still give this shot. Also, babies are born naturally low in this vitamin K. They're born naturally low in it, and mom's breast milk is naturally low in it as well. But we want to put a synthetic vitamin K shot injected into these kids to help 4 out of 4 million of these children with a condition that can cause bleeding inside their brain. So why is it naturally low in children? One is that this baby was just born. Their gut, their liver, and their kidneys aren't developed yet, right? They're not fully functioning, and we can't actually process this and absorb it and use it for anything beneficial. Two, it's naturally low because the natural absorption of mom's breast milk, the vitamin K in mom's breast milk, is so low, but it's also natural vitamin K, is that this is the only vitamin K that these babies can actually absorb into their systems, right? And so once we start injecting this vitamin K into these young children who are already, right, prone, right, already to the point where they need to start to develop a proper, healthy, natural gut flora, we're starting to put the synthetic vitamin K that has to goes through their gut, it goes to their liver, it goes to their kidneys, and it starts to tax it right out of the gate. And so the reason I kind of bring this up is because what does vitamin K actually do for us? I think it's done in conjunction with the vaccine protocols. It's done in conjunction to help offset the reactions that come in the weeks between 2 and 12 with a newborn. It's done to help offset that because we give 12 vaccines from week 2 to week 12, right? That's the normal vaccine schedule these days. And so if they can help, if they can do anything to help this process, right, these children not have such a bad reaction, they'll do it, right? And so this becomes bigger and bigger. All right, so as we get into vaccines, one thing we always like to talk about is that vaccination does not equal immunization, right? The only way that we can get proper, true immunity is from mom to baby, right? And so when we start talking about this, vaccines work in a way where they only stimulate that Th2 portion of the immune system, right? That portion that we talked about. So, because if they stimulate the Th1 portion, we would get the very disease that we were intending to start to fight, right? And so that's just the way that they work. So, but another way that this works is that we use that word externalize, right? That Th1 portion of the immune system, we said it was the externalization arm of this. So if you've got this baby who's had a stressful fear-induced pregnancy that's got their immune system already slanted towards that Th2 side, this baby has gone through a C-section, so it hasn't gotten that first gulp of mom's flora going through the birth canal. We've given her the vitamin K shot, and now from weeks 2 to weeks 12, we're going to give it 12 shots, 12 doses of vaccines. And all these vaccines do is stimulate that Th2 portion of the immune system. All of a sudden, that Th1 portion of the immune system is getting weaker and weaker and weaker. That Th1 portion is also called cell-mediated immunity. So all these vaccines do is they go inside those cells because the body can't get them out, right? So what happens is that the vaccines are driven further into the cells of the body, specifically the immune cells, because our body can't get rid of it. Now, if I were to go down the street and eat some bad chow mein, I would probably react to the point where my body would want to get that out, right? Somehow. I would hope so, because my immune system is strong. These children don't even have the opportunity to do that. And so that right now, these children are becoming so constipated, right, with toxins, and this baby's only 12 weeks old, right? All that's doing is getting this wheel spinning on this Th2 portion, right, or this long-term immunity system, and the immune system's getting further and further out of balance. It has no quick strike attack force available to it. But nature's really smart, right? Because nature gives mom's immunity to baby, right, for those 6, 12, even 18 months, right? So it's really smart. But what we start to do is we start to mess that up a little bit too. So immunity, right? Natural immunity goes from mom, goes to baby. We get natural, like mom passes natural immunity to baby. But what's also going on in developing and growing child is that naturally the inflammatory response is low in a child, right? In a newborn baby, the inflammatory response is really low, and it's low because the gut is growing, right? We're starting to propagate a lot of microbes and bacteria into the gut, and the body doesn't want a high inflammatory rate because it would stop that, right? So it's naturally withholding its inflammation state to allow the normal growth and development of all the different cycles in the body that have to go on, right? These kids are growing astronomically quick. Cells are dividing, organs are growing, bacteria is growing in the gut. All these systems are forming and forming. And then we introduce vaccines into this. Vaccines we know cause inflammation, right? It's part of the process. Some kids get it worse than others, but it happens, right? It's why they send us home with Tylenol, right? During those first vaccines. Here's a package of Tylenol if Johnny reacts. If he gets a fever, give him this Tylenol. It tastes like candy. He'll like it, right? That's the way it goes. So we've given this child Tylenol who's got a vaccine reaction, they're burning a fever maybe, right? Maybe they've got some swelling on their arm where they were jabbed. So what's Tylenol do? Tylenol stops the fever, reduces it, right? It bypasses the body's natural response to that injection. But what it also does is that Tylenol and acetaminophen bypasses what's known as the blood-brain barrier, right? The blood-brain barrier is what keeps the brain really, really safe. Unfortunately, vaccines and acetaminophen can pass through that. Now the brain has a natural protective coating that swims around. It's a chemical. It's called glutathione, right? Glutathione protects the brain from swelling out of control because the body will protect the brain before it does anything else, right? If our brain is in trouble, it will divert every single resource available to it to make sure that the brain is protected. And so we've got this glutathione that's doing nothing but protecting that brain because of the vaccine fever or swelling or hemorrhaging or anything else that could possibly be coming out of this. But what Tylenol does and what acetaminophen does is that it dries up that glutathione, right? So the Tylenol that was supposed to be given to reduce the fever actually is the last step for a lot of these kids to develop any sort of neurologic and brain and immune system dysfunction from vaccines. And so I'm not up here saying that vaccines cause autism or vaccines cause autoimmunity, but vaccines given to birth-injured children, given to Tylenol, given to any other proposition that starts to happen through this process, those are the kids that end up on this, right? These are the kids that get damaged, and we know this stuff. And so, is there a better way? Like, what are the chances? In fact, there's a huge new study out that just got released in the last week or so. There's a whistleblower at the CDC. It's all over the place now, all of the news that I get through my feeds. But what happened was that a CDC whistleblower, back in the 80s when they were doing studies on the MMR vaccine, the CDC decided to take some numbers out of reactions of children who are prone to getting autism as a result of the MMR vaccine. It was African American boys. So for the last 30 years or so, the CDC has known that the first MMR shot to African American boys has a 340% increase in autism diagnosis, right? That's a huge stat. Like, if you were a mom for the last 30 years, you'd like to know that, right? That stat's out there. Japan has made, in the last 5 years, has made another huge change in how they do this. Japan was one of the first country, or they gave the MMR vaccine to children at younger ages, right? So they were leading that charge. The MMR vaccine was given to kids younger and younger. Japan had the highest rate of SIDS of any country in the world. What they did, now Japan has switched that. Now they're the last one to give that MMR vaccine, and guess what their rate of SIDS has done? They're the best now, right? You never see it in Japan anymore. And they link that directly to that MMR vaccine. Vaccines is always a hot button topic. It's choice, right? It's choice for me. Doing my own research, studying what's right for my kids. If we know all this stuff, and we know how vaccines work, and we know how vaccines are supposed to work, do they give us immunity? I don't think they give us immunity, right? In fact, we can't interchange those words, right? Vaccines and immunity, we can't interchange those words, just like we said. But what happens, right? So if I don't get the flu shot and you do, like, why is that bad, right? If we have 80% of the Americans out there getting the flu shot and 20% don't, is that good enough, right? Herd immunity, right? That's the thought between herd immunity, right? Herd immunity is how much of the population has to be vaccinated to be a protective enough bubble for the people that can't be vaccinated to be safe, right? It started with measles. So herd immunity started with measles. It started in the 1950s with Baltimore. So in the 1950s, the mid-1950s in Baltimore, about 50% of the Baltimore population got measles, right? And so what they decided was that 55% of the population needed to be vaccinated against measles to protect everybody else. That was the line that we had to get to. It's gone from 55 to 70 to 75 to 80 to 83 for some reason, to 85, and now it's getting up to 98, 99, and 100%. But what they know is that the measles vaccine, it only works like it should 25% of the time. So how are we supposed to vaccinate 100% of the population? It only works 25% of the time. And yet we don't know, right? Measles vaccine is another great case for the immunity pass from mom to children, right? Measles should be naturally passed, the immunity to measles should be naturally passed from mom to child. But what's happened is now that since we've been vaccinating for measles since the mid-1950s, is that we've morphed, right, just like Dr. Collins talked about in his intro, was that we've morphed measles into a deadly disease for some people. Because the measles vaccine gives us a little bit of immunity, right? Just a little bit. But what happens is that that causes us, when our little children are caught, right, with measles, is that the immunity that was passed from mom, because it was so weak and it was tainted, passed to baby. Now baby has a little bit of that immunity, and that measles vaccine, and the body can't mount a strong enough attack against that measles that they got to warrant any help, and it now becomes a life-saving, crucial situation for some of these kids, right? And that's the way it's kind of morphed into this situation, is that we're starting to change the course of how our mothers pass immunity down to our kids, right? That Sig-A, all of a sudden they don't have the antibodies necessary to help grow natural, healthy, normal gut flora. We've given so many vaccines for so long that our immunity has been just enough to get us in trouble with the next generation, right? And now we're getting into like the second, the third, and now the fourth generation is coming, right? And so I think we need to be really worried about our kids now, right? Because 1 out of 4 kids are on a prescription drug. But I also need to be really concerned, I think we need to be really concerned about our grandkids, right? Because that's the next step in this evolutionary process. Is like, this isn't something that gets better with time. This is something that gets worse with time, right? Those 1 in 4 kids with a chronic illness, that's not something that gets reduced over the next 10 years. That's something that continues to get worse and worse and worse as time goes by. Sorry to bring this one down. But, yeah.
And so how do you figure, what kind of action can somebody take when it's what do you call it, an ordinance that your child can't go to school if he or she isn't vaccinated?
Well, that's one of the most important issues for me in my life right now. Is it's not there yet, but I think that there are some powers that be that want it to be like that. We certainly have exemptions in this state for the foreseeable future, but there's a lot of work being done to fight that and to make sure that we're doing mass forced vaccinations with that. But there are, exceptions out there and exemptions right now in this state. Do you have family members who haven't been able to?
Not that I know of, but I know I have friends that were they were getting flack from the school district because they didn't want to immunize their children.
Yeah. There are exemptions out there from the state, but it's becoming more of a targeted approach against parents who aren't doing that. And I think we're not informed. That's what tonight is about from my side. If we can give as much information out there to help arm these parents of these kids who see this, I think that's invaluable because I know for Dr. Collins and us, that's something that we want to grow stronger. We want more people.
We have copies of said exemption on the desk in there, in the front desk if you would.
Yeah.
I think that very thing is so important to share with parents because I used to work in the field that people that were in need were punished if the children weren't vaccinated. However, they could come in with a religious exemption or just, their own personal exemption, but they weren't told that.
Yeah.
And so a lot of us risk a lot in telling them. But I think it's really important for people to know that the majority of people don't know that.
Yeah.
And it's so important to share that information.
Yeah, just like Dr. Collins said, right? I think if we can be able to put that information out there in any way, shape, or form as possible. If we walked out on the streets and started polling people, right, can your children go to school without vaccines? We'd probably get, 70, 80% who said no, just because they didn't know that. Yeah, you're right.
What do you do if you're over the age of 12 and you've been vaccinated?
You bet.
Are your kids just like SOL?
No. On the good side of this talk, right? The good side of this talk is all about that. You've worked with Dr. Collins for long enough, right? The human body is so amazing on being able to remake itself. Our bodies remake itself so often, right? That the body can get to a point where it's healthy, it's functioning, all these things. So we talk about this stuff, all this stuff can be overcome, right? There hasn't been one case out there that this stuff hasn't been able to be overcome. But it takes some attention. All right, so as we work our way up to this imbalance, what's the other stuff that we talk about? A big one in my office I know is ear infections. It's the leading trip to the pediatrician these days is ear infections, right? Ear infections is such a huge thing, but let me tell you how ear infections work. It's such a, oh man, it literally is, right? Dr. Blackburn, Dr. Collins, have you guys ever had an unsuccessful ear infection case in your office?
I think so.
No, I can't remember one either. And that's what the stats point to. So the stats on the ear infections and success rates of children with ear infections with chiropractic compared to antibiotics is off the charts, right? Chiropractic has an 80% success rate with ear infections. Antibiotic therapy has a 40% success rate, but the kicker is that antibiotic therapy has a 4 times higher chance of reoccurrence for ear infections, right? Which leads right down the road to more antibiotics for another round or two, and then tubes. We do over 1 million tube surgeries on our children in the US every year, right? It's huge business, it's huge numbers. But the very anatomy of the ear infection, we know this stuff, and it boggles my mind that we don't get ear infection referrals every day of the week. So you've got this inner ear, right? This inner ear has a tube inside of it. It opens and it closes. It's like a muscle. There's a muscle on the outside of this tube that actively controls the opening and closing of that tube. That tube allows for the water and the fluid in the ear to drain properly down through the lymph nodes, right? What happens, right? We know that 80% of children have a birth injury to their upper neck, right? The nerve that comes from the upper neck comes out of the spine, goes back into the cranial vault, and it goes to the muscle that controls that tube to open and close, right? So we've got 80% of our kids who have birth trauma to their upper neck, and the leading cause of pediatrician visits in the US is for ear infections and fever. So what happens is that from a chiropractic standpoint, we do adjustments, right? Adjustments help relieve the pressure on that nerve that allow that tube to open and close and the water to drain through. From an antibiotic standpoint, you've got these children with water hanging out in their ear on the inside of their head, and it's really warm in there, right? It's the perfect temperature for bacteria and viruses to grow. They love it, right? And so we've got a petri dish going on inside our children's ears that can't drain out of there. So we give them 10 days of antibiotics. Last school year is the first year that I've seen just carte blanche prescriptions for antibiotics for 10 days for kids across the board, right? It used to be 4 days, right? It used to be maybe 7 days. And every kid I saw last year who came from the medical doctor with an ear infection had a 10-day prescription for antibiotics. Why? It's because antibiotics obviously aren't working, and we're creating these superbugs that we have to throw more and more antibiotics at, right? So these 3 and 4-year-old kids, we're just throwing antibiotics at them 1, 2, 3, 4 rounds of this. And so the antibiotics in that time, well, sure, they can go in there and they can kill that bacteria, right? But it also reduces that inflammation so the kid doesn't feel the pain anymore. But it does nothing about clearing out that dirty water in there, right? It just sits in there, ripe for another infestation, and here we go again. We're right down that track. And so 4 times the greater chance of reoccurrence for ear infections on this. Antibiotics, I think we all know that. Antibiotics clean out the gut, right? Which for children is growing and developing and growing our immune system. Some other stats out there are that a child under the age of 4 given 1 round of antibiotics has a 4 times higher chance of allergies later in life and an 8 times higher chance of developing asthma, right? 1 round of antibiotics given to a child does that because it starts to settle this stuff in motion that their immune system starts to get weaker and weaker with time. And when we start talking about our immune system that gets weaker and weaker with time, allergies and asthma are 2 autoimmune disorders, almost autoimmune disorders, to the point where the body always has their immune system turned on because it can't successfully fight what's coming inside of it, right? So we're always producing this phlegm. We're always fighting the world just around us just enough to keep that on just enough. And that's all it is. Toxic environment. I'm sure that, Collins Chiropractic has covered this in length, right? GMO foods, pesticides, chemicals, all of these things start to build up more and more and more in our children, right? We're giving this more and more to our kids. We talk about formula feeding, we talk about fever. Fever is a big one. For whatever reason, over the last 20 years, the acceptable fever has gone less and less and less, right? When do we give Tylenol? What's that?
Right away.
Right away, right. It's getting less, right? Would somebody give Tylenol and if your kid had a 99-degree fever? 100? 101? 102? 103? 104? Yeah, you bet. I mean, you couldn't say it any better, right? Let it burn, right? And so a newborn baby in the first year of life should have 7 fevers, right? Should have 7 fevers that spike and come down. The other side of this is, what about the kid that has no fever, right? That kid gets an award at school, right? When he goes to school and he never misses a day at school, he gets an award, right? But what's happened is that child has no ability to get anything out. And they internalize all of those toxins and all of those chemicals and all of those things that we put in our bodies to the point where it starts to eat away at us from the inside, right? And so this is the long-term sort of path that we see, right? Sometimes we see kids who have no immune system at all, and sometimes we see somebody who has such a weak immune system that they internalize everything into their cells, and it starts to get to the point where it eats away at it from the inside. So what's the tipping point? There isn't one specific tipping point on this. It's all of those things, right? Maybe it's that Tylenol. Maybe it's that formula feeding. Maybe it's that ear infection with the antibiotics. What is that thing that's going to cause this whole thing to kind of tip? And when we get to that tipping point, we start to talk about this sorry about that. So, that tipping point is autoimmunity, right? Over 200 names that we can place on whatever these diseases that we want to cause. Allergies, asthma, eczema, lupus, irritable bowel syndrome, ADHD, Crohn's, all of these things are the body's, is the body fighting itself, right? We start talking about irritable bowel disease. We start talking about mom's breast milk and how important it was to have that for a proper functioning gut. What we see is that there's a 40% of kids who don't get that develop irritable bowel disease, right? Irritable bowel disease is the precursor to Crohn's, which is a very inflammatory, long-term autoimmune disease that adults suffer with for a long time. It is really hard. And when we start talking about things like Crohn's and ADHD and teenagers, these things are really, really hard to get rid of because these things have been brewing in there for so long that we've got to spend a lot of time helping these kids revert back and build these things and these developmental milestones that they have missed out on, right? So again, Th1 imbalance, Th1, that cell-mediated externalization arm of the immune system, becomes weaker and weaker. And that Th2 side just turns on, and it just keeps brewing inside of us, and that's all we got. So what's the good side of this, right? Well, the good side of that is just the reverse, right? A healthy, well-based pregnancy, a birth process that's loving. Dr. Collins, you guys delivered 3 kids at home, right?
Yeah.
I got to tell Dr. Collins' first birth story. Can I do that?
Yeah, sure.
I don't know if you guys have heard this, but it's one of my favorite stories about Dr. Collins. They had a midwife and a doula, and both of them had an apprentice, an apprentice with them at their home. And so, first baby, Dr. Collins is at home in their new home. Mom or grandma and grandpa were there? Okay. So, 2 midwives, 2 doulas, Dr. Collins, his wife was in the bedroom giving birth. All these people running around doing stuff. Dr. Collins was the odd man out, right? All these different hands going on. And it was funny. We were like, yeah, I stepped outside and somebody came out to ask me if I wanted something to eat, so I had her cook me up a steak.
True story.
True story. It's not a bad story. It's funny, right? I mean, because it's unusual these days, right? To have a home birth, all these different hands, a lot of people doing stuff. Breastfeeding, fever, right? Fever's a good thing, right? Let that burn, just like you said. Let those fevers burn, being able to develop that immune system. One of the first things that I see happen with a child who's maybe been caught in this whirlwind of an imbalanced immune system, one of the first things that I see with those kids after we start adjusting them is a fever. And I love to see it. I call that a benchmark adjustment with these kids. Any kids with like ADHD, right? What's the common threads with a kid with ADHD these days? Very hyper, obviously, but they're really skinny, right? They can't make eye contact, and their immune systems are shy, right? And it's because all of those systems are so ingrained together, right? The brain, the immune system, and the gut are so interconnected that all of those things start to shut down. And so what we start to see when we start working with these kids is we'll see a fever start to burn for about a day or two. We'll start to see them get really sweaty. They'll hit a growth spurt, and they'll start to grow, right? It's an amazing thing to start to see once you start to wake these things up and these processes up. We like to challenge the immune system, right? Getting sick is not necessarily a bad thing. It's good for us, right? Challenges, the immune system can be just like a muscle. It gets stronger and stronger as we start to go. And so if we're talking about a kid who is getting into that kindergarten, first grade sort of area, we're talking about a kid who's probably going to get sick a little bit, right? But that's something that should get stronger and better with time, as opposed to a kid who's at that point is getting weaker and weaker with time. So how does chiropractic take a role in this? I'm sure you guys have heard the term the 3 T's, thoughts, traumas, and toxins. Are you guys doing the perfect storm next week?
Next month.
Yeah, so you guys are going to hear a great talk on the neurologic side of this. It's going to be awesome. We're going to talk about how these 3 T's start to interfere with the input into the brain, and this is how the brain starts to form pathways. Subluxation, right? Subluxation is the interference, is the neurologic interference to how we sense the world around us. We can't properly and adequately take in all the different sensations from all the different senses into our brain to process properly. We talked about birth injury. 80% of kids have a birth injury to it. The information that comes in from the world around us is called multisensory integration. Multisensory integration is hearing, tasting, smelling, sensing, but it's also kind of balanced position, right? Proprioception. All this stuff comes in from the world around us, and it goes directly into our brainstem and into a part of the brain called the hypothalamus. The hypothalamus regulates and controls the autonomic nervous system, the endocrine system, and the immune system. So what do chiropractic adjustments do? Chiropractic adjustments clear out that neurologic interference. It helps stimulate the immune system, right? That's why chiropractic goes so well with autoimmune diseases and imbalanced immune systems. 2 of the greatest studies that I quote, one comes from the New York Cancer Institute. They wanted to find out what they could do with their cancer patients to help boost their immune system, right? So if you guys know anybody who's been through any sort of cancer treatment, radiation, chemo, any sort of that stuff, you know that their immune system goes right off, right? Because all that stuff needs to be done, and it attacks the immune system and makes it weak. So they wanted to know what could they do in conjunction with all this therapy for these cancer patients that helps boost their immune system. What they found is that they did a study with people going through cancer treatment, radiation, chemotherapy. They had just the general population as a control. And then they looked at chiropractic, they looked at acupuncture, they looked at nutrition, they looked at whatever they could find, and they wanted to find out what worked the best. What came out of this was that chiropractic was far and above the best out of all of those. Chiropractic showed a 300% increase in an immune system response compared to the general public and, do this side?
Yeah.
Yeah. A 300% higher immune system, right, compared to the control group. The other one that we quote comes out of Life University. They looked at HIV positive patients. There is a specific part of the white blood cell in HIV positive patients that they can track. It's called the CD4. So they looked at the CD4 count of the white blood cell because a really low number indicates a very weak and imbalanced immune system to the point where people with HIV can't fight off any sort of infection or bacteria. They took half that group and put them under chiropractic for 6 months, and what they found is that 6 months of once-a-week adjustments improved that CD4 count by 50%. right? It was one of the most amazing things that they found, right? 50% increase in the white blood cell count of people who are so prone to chronic infections that they can barely step outside, right? That's a huge thing to those people. In closing, Dr. Collins opened it up very well with this. Same idea here, right? Your body's ability to heal is greater than anybody has permitted you to believe. I think with all of the things that we're doing, right? The symptom-based healthcare that we have causes such an imbalance in our bodies and in our ability to grow and develop naturally that we somehow overshadow the fact that our bodies come with a ready-made immune system that's intended to fight off anything that's out there and to keep us strong. And I think that chiropractic does a beautiful job of being able to work with that power inside of us that stimulates our immune system, that clears our neurologic system to increase the vibrancy and to increase our ability to thrive as we grow and develop, and especially our children, right? Because I think our children are in trouble, right? And I think our grandchildren are in trouble as well if we don't start to get out with this message a little bit. I'm here for questions. Again, I appreciate the opportunity to get out and speak tonight. This is something I'm really passionate about, and I know that Dr. Collins and his team is really passionate about it as well. So I thank you.